Hello, my name is Rachel Ecker, and I'm going to go over the Responsibilities in Action workbook from the MAP program. And we're going to start with Unit 1 today. And this is based off of the December 2025 workbook. Just a couple of reminders. Once you're MAP certified, your certification must be renewed every 2 years. You are able to recertify up to 90 days before your expiration date. If you expire, you're no longer able to touch any medications, administer any medications, or have any responsibilities regarding medications. So that is very important to know. We're going to start on Unit 1. So with MAP, you're going to be having a lot of interaction with MAP consultants. A MAP consultant is a registered nurse, a registered pharmacist, or a healthcare provider. Healthcare provider is anyone who's an authorized prescriber, such as a nurse practitioner, physician's assistant, doctor of, dentist. So those are the most common types of MAP consultants. So it's important to know when to notify the MAP consultant and when to notify a healthcare provider. Some examples of when you may need to contact a MAP consultant would be when too much or too little of a medication was administered. If the medication was omitted or not given, that's what omitted means. If the healthcare provider order, pharmacy label, or the medication sheet do not agree. So if something doesn't match up correctly, then you would need to reach out to the MAP consultant. So MAP consultants must be available 24 hours a day, 7 days a week. So DPH does require that a single-page emergency contact list be posted near the telephone at all MAP registered sites. The emergency telephone numbers must include 911, poison control, MAP consultants, and any other emergency numbers. Sometimes you may even have a guardian listed on there, or a person who has a significant seizure disorder. You may also see a seizure, you may see their neurologist listed as a emergency contact as well. So this is a nice example of what it should look like. And if the home has more than one person supported, it should have everyone's healthcare providers listed. So if Sally has her primary care is Dr. Smith, and Bob has Dr. Jones, you're going to need both of those doctors listed on there and separated by person supported. So you always want to ask your supervisor where the emergency contact list can be found. Again, it should always be listed close to the phone so it's easily accessible. So who can act as a MAP consultant? So we did go over this on the previous page. There's options of a licensed practical nurse, a pharmacy technician, a registered nurse, a receptionist at the healthcare provider office, a healthcare provider, a MAP certified supervisor or a program director, and number 7 is a registered pharmacist. So out of those, there should be 3 correct answers. The correct answers would be 3, a registered nurse, number 5, the healthcare provider, and number 7, the registered pharmacist. So the other folks are not able to act as a MAP consultant, and they cannot give MAP staff instructions. You always want to learn about the people you support. 2 of the most important responsibilities are watching and reporting any changes in the people you support. A change can be physical or behavioral, and those are all very important to keep an eye on. You will first get to know the person by learning about their personality and abilities. You'll also learn about their physical conditions and medications. This will help you notice a change in the person. You can learn about a person who is new to you by observing and watching the person, talking with them, listening to the person, communicating with the person's family and your coworkers, and then reading about the person's life and health history. You want to make sure that the people you support receive the best care. You can help make this happen by noticing changes and reporting them to the right person. The principles of medication administration. You will help make sure that medications are given safely. You'll do this by following principles of medication administration. These are mindfulness, supporting abilities, and communication. Mindfulness, remain alert and focused during medication administration. Pay attention. This is so important. Think about what you're doing and not something else. Be observant and report your observations. You'll become familiar with a number of things as you begin administering medication. This includes which person receives what medications at what time. It can also include the size, shape, color, and markings on the medication itself. Because of this, do not allow medication administration to become routine. I'm going to say that again. You do not want to allow medication administration to become routine. Always remain mindful. Never memorize the medications that people take. Consider changing the order of who you give medications to first. This will help you remain mindful and stay focused. Remember, no cell phones, earbuds, smart watches, or other Bluetooth devices during medication administration. Supporting abilities. Help the person to function as independently on their own as possible. Encourage a person to participate fully in the medication administration process based off their abilities. So another example of this would be teaching them about the medication that they take. What is it for? How often do they take it? Observe for any side effects that they may be experiencing. So let the person be as involved as possible. Maybe they can get their own glass of water when it's medication administration time. Communication. Read the healthcare provider order, pharmacy label, and medication sheet. Make sure that they agree. Contact a MAP consultant as needed. Tell your supervisor after contacting the MAP consultant. Talk and listen to the person while you're administering their medications. Communication is a big part of your job. To communicate is to share or exchange information. In your role as a MAP certified staff, you'll communicate with many people. This will include people you support, their family members. It will also include your coworkers and supervisors. You will also communicate with the healthcare provider, pharmacist, nurse, and others. In addition to talking, communication also includes documenting, listening, tone of voice, facial expression, body language. For communication to be effective, you want to remember to speak clearly and slowly, look directly at the person you are talking with, listen carefully, take notes during your shift if needed. This will help you with accurate documentation. If information is given to you, repeat it back to the person. This helps to make sure that you understood it correctly. Ask questions if you do not understand something. Respecting rights. Like you, the people you support have the right to be treated with dignity and respect. Everyone also has the right to privacy. Confidentiality means keeping information private. Only share information about the people you support with others who are involved in their care. In relation to medication administration, people have the right to know what their medications are and the reasons why they are taken, know the risks of taking the medication, know the benefits of taking the medication, be given medication only as ordered by the healthcare provider, and they have the right to refuse medication. A person may refuse to take their medication. If this happens, the first thing you should do is ask them why they don't want to take it. Then report that information to the prescribing healthcare provider and your supervisor. In the end, you will want the people that you support to get their medications as ordered by the healthcare provider. The problem cannot be addressed until you know why the person is refusing their medications and report the reason. And this also, I have a perfect example, is a person that we supported had didn't want to take a liquid medication anymore, and they just stopped taking it. And nobody asked them why. They just thought the person was being challenging. And come to find out, there was alcohol in this liquid medication, and so it hurt them and gave them very bad indigestion. So asking the question why can be very insightful. This same medication did come in a tablet form. We let the doctor know that it was giving them significant heartburn, or what we thought was heartburn. And so they were able to switch it over to a tablet form, and the person was able to tolerate it without any problems at all and took their medication. So asking them why should always be the first, not to be judgmental, because it is not our place to judge them, because we all have the right to take or not take our medication. But it is important to find out if there's something that can be addressed, then we should be advocating for that. So a person has the right to be given medication as ordered by the healthcare provider. And here's an example. Ellen Tracy has an order for PRN medication. PRN means as needed, if you don't know. The medication is to decrease her anxiety. You will only give the medication when she displays symptoms of anxiety. The symptoms are described in her healthcare provider and or support plan. A support plan, if needed, is an extension of a healthcare provider order. Ellen communicates using simple words and short sentences, but she cannot tell you directly when she's feeling anxious. Her plan describes what you will observe when she experiences anxiety. This is how you're going to know when to give the medication. You cannot administer PRN anti-anxiety medication for symptoms other than those described in her order or support plan. Protocols and support plans that reference medication are considered healthcare provider orders. The instructions in a healthcare provider order will include how and or when to give a medication. Sometimes these instructions are long. If that happens, the order will be written as a protocol or support plan. A protocol is used when the reason for ordering the medication is to lessen a physical symptom. An example of this is a seizure protocol. This type of protocol gives instructions for the use of an anti-seizure medication. A support plan is used when the reason the medication is ordered is to help lessen a behavior. An example of a support plan for anxiety. So here, the specific symptoms that show us that Ellen is anxious: she bites her hands for more than 4 minutes. She has head slapping for longer than 30 seconds or more than 5 times in 4 minutes. First thing staff should do is to attempt to talk to Ellen in a one-to-one conversation about her current feelings and difficulties. Staff will attempt to direct and involve Ellen in a familiar activity such as laundry, meal preparation, and that serves as kind of a distraction. If unsuccessful with A and B, the Ativan may be administered. And then you see the order here, which has the Ativan 0.5 milligrams once daily as needed by mouth. Must give at least 4 hours apart from her regular scheduled Ativan dose. And it says to refer to the healthcare provider order. If anxiety continues after the additional dose, notify the healthcare provider. So this is something that the MAP staff would have the responsibility of, following this protocol exactly and documenting the specific symptoms that were seen and what worked and what didn't work in your note. So for example, if you tried laundry and Ellen started stomping her feet and crying and biting her hand more, you would want to make sure that you document that. So that way we know perhaps laundry is not the best activity to try to distract her when she's having an off day. So let's review Unit 1. Contact a person's healthcare provider for health-related issues, concerns, or questions. MAP consultants are available 24 hours a day, 7 days a week. They can answer medication questions and/or give advice about medication issues. A MAP consultant is a healthcare provider, which again could be a nurse practitioner, physician's assistant, a dentist, a doctor, a registered pharmacist. So this is why we use East Bay Pharmacy, and we have a pharmacist available 24 hours a day, and after hours they have somebody on call to answer phone calls, and a registered nurse. So this could be calling the doctor's office and speaking with the registered nurse there. They can give you advice. Or if a person you support is in the emergency room and they have 8 o'clock medications, but you are there at 10 o'clock at night and they missed their 8 p.m. meds, you could ask the registered nurse to give advice about how to administer their 8 p.m. medications. And you want to get it in writing if at all possible. Your supervisor must be notified anytime the MAP consultant has been contacted. To recognize changes, staff must learn about the people they support. A medication administration principles include mindfulness, supporting their abilities, communication, and everyone has the right to be treated with dignity and respect. Thank you.